I actually prefer to put the BioPro thumb into a younger, more active patient. Typically, they're going to be stage 2 to 3 arthritis rather than pantrapezial. And while pantrapezial arthritis is a relative contraindication, I have had people with STT arthritis either arose after the BioPro thumb was put in and had subsequently a workup and evaluation showed that it was just in the STT joint, and we went and did a resection of just the small distal part of the scaphoid at the joint, and they were very satisfied. So that's an option, and why it's not a full contraindication. The more advanced age, particularly, it's more bone quality than age, because I encourage joint replacements to improve quality of life. But if a patient's 75 and not very robust and their trapezium is squashed down, they have pantrapezial arthritis, they're mostly looking for pain relief, and they're not going to be high demand on that thumb. They're less likely to be a good candidate for a BioPro thumb or any other implant arthroplasty.